Hello, everyone. Welcome. Today I have joining me Dr. Jay Feldman.
Thank you for having me. Dr. Siddiqui, happy to be here. I'm very excited. A lot of respect for what you're doing.
Thank you. It's such a pleasure to have you and to be able to collaborate with you. So before we dive in and start doing the introductions, tell us an interesting story or a funny story that you've experienced in the hospital or while being a resident.
Okay, so you sent me this question earlier, and it took a lot of thinking. I mean, with all the hours we spend in a hospital, every day has like 2 or 3 things that we want to go home and talk about. But the one that I picked, I think, is going to be super interesting and helpful for people who are either interested in medicine or, have done it or don't think they can do it because they're not the type, they're queasy in front of blood. But this one is from my first day ever working in the emergency department. I was a scribe for 3 years, and this was my very first day. I was working in Naples, Florida, and it was about 6 hours through my shift. We had seen the normal emergency department stuff. Nothing crazy. This was a level 1 trauma center. So the patient that came in, who was not our patient, but I saw a storm of people running into this room, and naturally my attending's like, let's go see what's going on. So we walk in there, and this lady has like 3 of her fingers dangling from her hand. One of them was totally off and being held in a bag with the other hand. Apparently she had a lawnmower accident and just mutilated her hand. Before this day, I had never seen gore or blood. I had always thought that I would be okay with it because I loved medicine. But when you see something like that for the first time, I sat there for a couple seconds, like, okay, look at it, like, train yourself. It's going to be okay. Just think about anatomy, not about that. And
try not to faint.
I didn't faint. I made it about 2 minutes, walked out of the room, and made it through like the last hour or so of my shift. But I was seeing stars. I was nauseous. I was like, this is still in me. This has really affected me. I finally make it out of that shift, and I walk out. I was walking to my car. I'm like, wow, like, I can't do this. I was still seeing stars, and I vomited on the side of the hospital, and just vomited, purged. Finally sat in my car for like an hour. So many thoughts racing through my head, like, I should quit. This clearly isn't for me. And then something clicked, and I'm like, that was freaking awesome. I loved every second of that. The vomiting, the hand gore, like, that was so much adrenaline pumping. And I think that's what that was from. I was disgusted. I was nauseous. It was horrifying to see, but that's when I was like, yeah, like, this is something special. Like, if I do this, I'm going to not only be okay with seeing this, but I'm going to get to do stuff like this every day that nobody else gets to see or deal with or do. And I don't think I've ever seen a gorier scene in my, I guess, 5 years in medicine and rotating through hospitals. That first day was the goriest scene that I've ever seen. And I think it was a sign.
First day.
First day, the goriest thing that I've ever seen. And I think it was a sign. That's when I was like, yeah, I got to do medicine. This is awesome.
That's an incredible story.
Thank you. It sticks with me.
So tell us a little bit about yourself, who you are, what do you do?
So my name is Dr. Jay Feldman. I just graduated medical school about 3 months ago from Touro College of Medicine in Manhattan. I'm now a family medicine resident down here in Orlando, Florida. I'm working at Advent Health Hospital, one of the best hospitals in Florida. I love it. A little bit about me. I'm an entrepreneur. I've been doing business since I was 17. I've got all kinds of crazy side projects that I love to death. I've got a golden doodle named Moses who's over there sitting in the corner. I love him to death. That's basically it. I mean, there's a lot of other stuff in between. Let's see. We talked about family medicine. I'm not interested in doing any fellowships. I think learn as broad as you can is my strategy, and see where life takes me from there.
That's amazing. So our next question is, what are some of the challenges and struggles going into residency? I know you've just started residency, so this will be fresh. So we'd really appreciate your input on what it's been like transitioning from medical student to a physician now.
Yeah, especially transitioning from a fourth-year medical student to a physician. And you know what fourth year of medical school is like. The last 6 to 8 months were spent basically working on my own stuff on my own hours, working with some friends and electives. And then boom, you're a resident. You expected to know everything. You have responsibility. Granted, there's a lot of hand holding. Like I've never been like thrown out on my own and said, you're responsible for this patient's life. But mostly the hour shifts, like the time responsibility has been the biggest change. And right now I'm on a newborn rotation. I get to play with babies every day, and every month's been different. But the hardest thing has been not having weekends off. And I'm always been a morning person. I wake up at 4 a.m. most days anyways, so that's not been a big change. But getting off at 7 p.m. every day, it's basically like you wake up, I go to the gym, I go to work, get home, go to sleep, wake up, gym, work, sleep, wake up, gym, work, sleep. And then with my 1 day off, I do this pretty much every single week. And that is taxing. I'm starting to feel it. In terms of residency and like how the workload has been, the expectations, I chose a residency program where the people are all really nice. The hours and the responsibilities on those shifts aren't too crazy. And that's just because of, my lifestyle, all the other things that I have going on, and the type of life that I want. I've seen a lot of programs who are really malignant, and people are miserable going to work every day because the residents are mean, the attendings are mean. And I think it eats a little bit of your soul. And my program, thank God, has not been like that so far.
That's very great. Because talking about malignant programs, so for me, I actually didn't want to do family medicine. I didn't even think I was going to go into family medicine. I was always like, I'm going to be a surgeon. And so what I got to experience doing sub-Is was I saw how malignant certain programs can be and certain specialties. And it kind of opens up your eyes. It makes you realize, is this what you want? Do you want to deal with this on a daily basis? And I feel like I'm a happy person. I want to be in a happy field, and I want to be able to do a little bit of everything.
I totally agree with you. Like I'm a chronically happy person. I like to stay happy. And on my surgical rotation during third year was the least happy I've ever been. And that wasn't just me, that was everybody. And that's just the culture that was there. And if I had to put myself through those 5 years, even if I came out a plastic surgeon or whatever it would be on the other side of that 7-8 year track, that just is not worth it for me. You change as a person. It eats away at your soul a little bit every day. And that's not something I wanted for myself. There's a lot of different paths.
Absolutely. You just got to find what you're passionate about and just run with it.
Exactly. But also make a smart and informed decision, which I hope we could talk about, because that's a thing I think a lot of people struggle with. Absolutely.
So let's actually talk about that. How do you decide what's a good specialty for you? And what's your input? What did you do to figure out that, family medicine is it for you?
So for me, there was I'm actually creating an algorithm that I have it written down right here on how to choose a specialty. There's some that are dying. I think like anesthesia and radiology are on its way out with AI and things that are popping up. I've talked to a lot of them about it. They're all very scared. For me as an entrepreneur, I think family medicine made a lot of sense because for me, it's about learning. It's about becoming more of a doctor and learning a broader spectrum of medicine. So that way, no matter what it is, I can talk about it, I can treat it, I can turn it into a business. I've got several different little medical things in the world that I want to start attacking as soon as I get my medical license next year. Family medicine made a lot of sense for me because you get to do everything. You rotate through every specialty. You learn enough about every piece of medicine where you can talk about it and have an informed conversation. And you can help that many more people because not everyone needs an electrophysiologist, but everyone needs a primary care doctor with a knowledge of common problems. And that's what I think attracted me to family medicine. But for people whose goal it is to be a family doctor, give back, and work for a clinic, I would not suggest it. And that is probably very controversial. I did not say that in my interviews because I know I probably wouldn't have gotten a spot anywhere. But working in a med mill where they give you 20 minutes to see a patient and then you go home and you have to document all day, that is no way to live. So there's a lot of different factors to take into consideration.
Absolutely. So let's talk about how you de-stress. What are certain things you do? I know you said, you're working a lot, and being an intern takes
Yeah.
a lot out of your schedule. So you don't really have a lot of time for yourself. So how do you go about balancing life?
So I think that de-stressing is a whole science of its own. And it's a science that you have to study and practice in order to be good at it. And that's something I've been working on for a long time. This might sound corny. I listen to a lot of like Tony Robbins and inspirational people, Tim Ferriss, who all have kind of mastered this balancing act. And a lot of it comes down to your daily rituals, which I've been trying to implement into my life for the past year or so. And they help a lot. Like I said, I don't have to be at work at 4 a.m. I wake up at 4 a.m. so that I can go to the gym. I can do my meditation. I can shower. I can hang out with my puppy for an hour before I leave him with my roommate. He's loved. He's getting a lot of attention. But just all of those things that, start you off on the right note. And then when you come home, you have to be able to unwind and make sure your head is clear. I meditate twice a day. I take baths, as corny as that sounds. I strongly believe in like aromatherapy and, just unwinding and really just clearing your head from long days of, it gets stressful on the floors and stuff, especially when you have someone who's really riding you and asking you questions, and you have patients who are really riding you, and it's a lot. And balancing it's a science that I think everyone needs to practice, or that's when burnout happens. Mm-hmm. And especially with residents, there's a lot of people out there that I've talked to who are depressed and anxious every day, and they don't want to go to work. And you just have to, gratitude is another big one. Like, I wake up every day, and when I'm walking around with Moses, I'm like, I am so lucky to be able to go be a doctor right now. Like, holy crap, I'm a doctor. And you just say that to yourself over and over again. And that helps a lot with like managing the anxiety and stresses of work. What you also have to train yourself to love. I mean, we get to do an amazing thing, and you can either look at it as that or look at it as crap, I have to go to work. Yeah. So it's just how you look at it for the most part, and all those other things.
Absolutely. So let's talk about students. Have you been able to work with medical students, and how do you go about that?
Yeah, so we have a bunch of students. Depending on the rotation we're on, we get like 1 to 5. And it's still a very weird experience for me because I was a student like 2-3 months ago. Yeah. And they probably know more textbook medicine than I do coming out of their step 3 and not step 3, step 1 and step 2. Mm-hmm. But they don't know anything about clinical medicine, which is fun because now I'm starting to learn. Now I'm starting to actually get hands-on and treat. So I'm able to teach them, but it's still weird, like treating them as students because I'm that far removed, which is pretty crazy. Mm-hmm. But yeah, I have students. I don't expect much of them. I teach when I can, and I expect them to teach me too. I like asking them questions and seeing what their knowledge base is and hoping to learn from them.
Like asking them to look things up for you?
Asking them to look things up, write things down when I'm in there talking to a patient and I don't want to pull out my paper and take notes. That's one of their main jobs. Like, you better be recording everything. Absolutely. But yeah.
I think that's great. So let's talk about what your advice is, coming right out of medical school. What would be your advice for pre-med and medical students from all the experiences and everything that you had to go through, from applying to medical school to applying to residency and getting into residency?
So for pre-meds specifically, because different advice for pre-meds and med students, that's one of them's thinking about taking the plunge. One of them's already spiraling. Pre-meds, I would definitely say shadow as much as you can. Being a scribe, I think, was the best thing I ever did. Mm-hmm. But that's just one little area. The emergency department is way different from what I'm doing right now in newborn. Mm-hmm. So I think you should shadow multiple different specialties because the chances are you're not going to end up in the specialty that you think you are. Mm-hmm. So make sure that you're okay at being an internal medicine doctor, spending 60% of your time on a computer, or a family medicine doctor in a clinic. I mean, that's not something I would ever want to do, but that's the reality of medicine now. It's not what it is on TV. Mm-hmm. So I think they need to get that real life experience, go shadow and see what it's really like, talk to a lot of doctors and listen to them. That's for pre-med. Granted, if there's a lot of people out there who want to do it for all amazing reasons, and they're going to be exactly the specialty they set out to be, mm-hmm. and they're going to do awesome. So keep at it. For those medical students, I think the biggest thing that you have to think about right now is your specialty. and where you see yourself in 10 years. Because there's a lot of doctors who are miserable, and there's a lot of doctors who are living the best life ever. And medicine can go either way. So really put a lot of thought and effort into not only getting the specialty you want, but making sure that it's the specialty you want. And not just for the money or for the lifestyle or for the, ruler measuring contest with the other doctors, because a lot of times that's what it is. People, want to be a surgeon because it sounds cool and because other doctors think it's cool. But if you end up going through a surgical residency, like, who are you going to be at the end of that? Mm-hmm. Are you going to be 40? Are you a woman? Do you want to have kids? Like, what kind of life do you actually want? And that's the biggest advice that I would have for medical students. And to take your auditions very seriously. Mm-hmm. That's something that I kind of overlooked as a medical student, especially going into family medicine. You don't value it as highly. But I think if I were to go back, that's one thing I would do differently. But it ended up in my favor, thank God. But a lot of my fellow classmates, it did not. So that's some life advice.
So you are a DO. Tell us about why you chose the DO route versus the MD route.
Sounds good. I actually scored a 95% on my MCAT, 95 percentile. Had quite a bit of choices within Florida. I wanted to go to New York City, so that was a big factor. Mm-hmm. And DOs have one of the most overlooked skills, I think, in medicine, and a lot of them don't even use it, but that's osteopathic manipulative treatment, mm-hmm. Manipulative therapy. I have a table right in my home where I treat my friends, and just the way that they learn medicine, I've seen is different. And I've noticed a difference when I work with DOs and MDs. Granted, not all DOs are the same. Not all DOs use OMT. Not all DOs are great doctors. But that's just the type of medicine that I wanted to practice. Mm-hmm. And I love OMT. I treat every single one of my friends that walks through my door so that I can get a bunch of touches. But I'm able to really help them instantly. And if I can do that, granted, I don't think it's a replacement for medicine, but if I can use that to supplement everything else that's going on, and I want to treat young, healthy people long-term. Mm-hmm. Healthy, super achievers who are just trying to optimize their health, get to that next level. Mm-hmm. OMT is an amazing skill in my toolbox that sets me apart from most other doctors. That's why I chose DO.
Beautifully stated.
Yeah.
So if you were to change something, going back, is there anything that you look back that you regret going into medicine? And if so, why?
So for achieving what I want to achieve long-term, I'm one of those people who writes down their goals. So I know where I want to be in 10, 20 years from now. So I don't regret going into medicine. I think that does not apply to everybody. Medicine is not what it looks like on paper and on TV and in the movies. Let's see, regrets are things that I would do differently. I'm exactly where I want to be in life right now. I've got a plan. I'm on the right trajectory. So I'm not sure if I would do anything differently. I think if you work as hard as you can and you know what your goal is, things will work out the way that they're supposed to. And I strongly believe that.
Absolutely. So yeah. Any last minute thoughts?
Last minute thoughts? Let's see. I think I wrote something down. Okay, so one of our questions was, if I had a dream to see anything happen in medicine in my lifetime, what would it be? Mm-hmm. I would like to address that one because I think that's super important, especially for upcoming doctors. Mm-hmm. Medicine is changing, I think, really fast, and I think our generation is the one that's going to change it. But in the current environment, it's so hard to be a primary care doctor, which I think is one of the most interesting specialties that you could be, because you get to learn everything and treat everyone. It's awesome, but it's so undervalued, it's so underpaid, and the people are overworked. Mm-hmm. And I think that's because doctors are spending so much time at computers and there's a huge insurance demand. Mm-hmm. So I would like to see that change. I would like to see our primary care doctors, I would like to see that specialty go up in ranking in terms of pay, in terms of lifestyle, in terms of desirability, because I still think it's the best specialty. I think we need to get our doctors off of computers. I think end-of-life care is an insane thing. I think the extent that they go to keep people alive when they are in a downward spiral and they have everything wrong is just ludicrous. And it's driving our government, it's driving our healthcare budget just emptying the drain, and it's a horrible thing. And it's a horrible thing for the patients. The patients, the families, everybody suffers. So I would love to see that change. And what was my third one? Government intervention in nutrition. I think the next like healthcare renaissance that we're going to have is when people change the way that they live. And I don't think they're going to do it on their own. I think they need a push.
Mhm.
And I would like to see the government get involved in that push. And that's going to be like regulating food that people have access to and the cost of food. I think that's the big first step.
Absolutely.
So I think there was a lot of good advice that was talked about here. And
Absolutely.
it doesn't apply to everybody is the other thing. Like you'll talk to one doctor, he'll tell you one thing. You'll talk to another doctor, he'll tell you an entirely different thing.
Mhm.
I think the best thing that people can do is listen to as many people as they can
Mhm.
and then figure out what the best option is for them. Because I am very far from most people, but some people might identify with me. You know, some people are more introverted and they're interested in a certain thing and they only want a certain thing out of life, or they really just want to cut and they don't care how miserable they are. And I get it, but yeah, that's my advice. Listen to as many opinions as you can and form your own.
Absolutely. Well, thank you so much for joining us and answering all of our questions and for taking your day off to spend with us and our viewers. We really appreciate your time.
Thank you so much for asking me to be here. And I just want to acknowledge you for what you've done. I saw your artwork and your videos, and you're educating medical students and residents all across the world right now. And you're doing an amazing job. Keep it up. And you edit your own videos. Everyone should know that. She edits her own videos. She deserves a round of applause for everyone who's watching.
You're too kind.
Dr. Siddiqui, I'm honored. Thank you.
Thank you so much.